Hi everybody. Today I am in Netherlands in the city of Rotterdam, and Rotterdam is famous for many things like windmills, but in endocrinology Rotterdam is famous for the a very important diagnostic criteria for polycystic ovary syndrome or PCOS. So there are a lot of criteria by which we can diagnose polycystic ovary syndrome, like NIH criteria 1990, Androgen Access Society criteria, and also Rotterdam criteria. So Rotterdam criteria is one of the most and widely accepted criteria for the diagnosis of polycystic ovary syndrome. Now, in order to diagnose polycystic ovary syndrome, what Rotterdam criteria says, there should be three things. The number one thing in diagnosis of polycystic ovary syndrome using Rotterdam criteria is oligo-ovulation or anovulation. So, which means that a woman who is not getting her periods, monthly periods regularly, there is a delay more than a month, like it could come after 35 days or 45 days. So the periods are not regular. So this is one of the criteria of Rotterdam for diagnosing polycystic ovary syndrome. The second criteria of diagnosing polycystic ovary syndrome is having an androgen axis, which means either chemically, biochemically, or clinically, like by clinically, which means if you have hirsutism, which means hair growth, or if we do a blood test in which the male hormone level, which is testosterone, which is on the upper side. So this is the criteria number two. And criteria number three is if you do a pelvic ultrasound examination and if you find to have a polycystic ovaries, which would be having a volume of ovaries more than 10 cc, either both or one, or having a polycystic ovarian morphology. So out of these three things, in order to diagnose the polycystic ovary syndrome, you need to have at least two things to label someone having polycystic ovary syndrome. So here is a very important message. Just having a polycystic ovary morphology on an ultrasound does not mean that that individual or a woman has a polycystic ovary syndrome. As I said, according to the Rotterdam criteria, you need to have at least two criteria to fit into the diagnosis of polycystic ovary syndrome. At the same time, if somebody does not have a polycystic ovarian morphology, it does not exclude polycystic ovary syndrome. So what I have found in my experience is that most of the people who actually do not have polycystic ovary syndrome, just because they have done an ultrasound because of some other reason and it was found to have a polycystic ovary morphology, they believe that they have polycystic ovary syndrome. So this confusion is not only among the laymen, the common people, but this confusion is also among the doctors. So it's very important that any woman who has the above symptoms should consult a qualified endocrinologist. There is always a treatment. So I stop here. I just wanted to talk about the criteria which is accepted, widely accepted. Thank you very much.